Just recently, I got my Harvard Women's Newsletter, and they were talking about radiation and the heart, and that in many cases, there's a narrowing of the coronary arteries because of radiation. Could you elaborate on that, please? I'm not sure.
Yeah, I think there are two people who can answer that. I'm happy to direct that. First, Ron is a radiation oncologist, and I'm sure can make good comments about this.
Well, that's a great question. It's actually been known for many years that one of the long-term effects of radiation, any part of the body, frankly, is the potential to cause atherosclerosis or narrowing of the arteries as a very long-term effect of the radiation. And that the process, how that occurs and why that occurs, is actually still being investigated. So I can't tell you why that happens, but it clearly does. In the area of breast cancer, it has been a critically important issue, particularly since our paradigm switched from mastectomy to breast conservation treatment as the treatment for the primary cancer in the breast. Breast conservation being just remove the lump, but then you treat the rest of the breast with radiation. And then most specifically for left-sided breast cancer, the most common technique for treating the entire breast is for the radiation to come in at an angle so that we don't want to give radiation directly into the heart and lung. But depending on the woman's chest wall shape and the position of the heart, particularly in 20, 30 years ago, that basic radiation setup would inevitably expose the surface of the heart to a dose of radiation. And the surface of the heart is where those big blood vessels are that you don't want to have blocked and result in a heart attack. And some of the early studies on breast-conserving treatment, if you looked at overall survival, it was also clear that we were curing the women of breast cancer, but if you waited long enough, unfortunately, a few of them would die because of heart disease, because of that process. Now, this is all by way to lead up to the fact that we are very aware of that and fortunately have developed the technology now in the last 10 to 15 years, particularly so that we can specifically avoid the heart and those blood vessels when we do radiation on left-sided breast cancer. So it's a well-known phenomenon. We've paid attention to it, and the technology is now allowing us to avoid it.
Nanette, do you want?
Mark, real quickly, while I have the floor, I'm chagrined after being specifically instructed to remind all of you, you have a survey on your table. We would love to have you fill that out to help us do a better job with the symposium and the public forum every year. So thank you if you will do that before you leave this evening. Thanks, Mark.
Nanette, do you want to make any additional comments about cardiovascular risk?
I think that's beautifully stated by Dr. Dorn. I have nothing much to add except that it's remarkable that the heart is actually pretty resistant to radiation. The muscle cells themselves are pretty resistant. And so it's just the blood vessel linings that tend to get damaged. This has been known for a long time. The presentation isn't any different from conventional atherosclerosis, which will get most of the people that aren't gotten by their breast cancer eventually, if they're unlucky. But the other thing is that the valves sometimes can get damaged, and this is another structure of the heart that's especially vulnerable to radiation. So we're lucky that we have brilliant radiation oncologists who can guide the beam well. I've seen people with aortic stenosis that were radiated to the chest wall.
Great, thank you, Nanette.